Well, laser is light, and light is energy. So basically, what we're saying is that we treat veins with laser, which means like treating them like with any other modality. In other words, if you treat them with anything that is going to affect that vessel adversely and make it go away. Adversely is a good term here, rather than it's not adverse for the patient, it's adverse for the vessel, and therefore it's going to go away. So laser is one of those modalities, and for me, the right modality at the right time is the right thing to do. It's not sort of laser or sclerotherapy, which is injections of stuff into those vessels, is the important thing. It's who is going to do it and how they're going to do it. That's much more important than laser. So if you give laser to somebody who doesn't know how to use it properly for the right indications, then they could do a lot of harm with it. And likewise, if you give sclerotherapy also, the injection, somebody who is not very good at doing it, then they're not going to do a good job. So the game changer here is the person who's doing it and not what it is that you're actually doing. So one of the important things is to trust the person and to get a feel for that provider, any provider, whether they know what they're talking about and whether they're confident doing what they're doing and what it is. If they can explain it to you properly and adequately to your satisfaction, then I think this is the important thing. So it's not what they do, it's how they do it, and basically who's going to do it, and all that stuff, the experience behind it. So going back to that specific issue of laser, it is not true that, okay, if you use laser on spider veins, they will come back. That's not the important thing to say. What is more important is that those vessels, they can come back in different places. They don't have to come back in the same one. When you actually occlude a vessel and it perishes, it goes away, then other vessels can come in neighboring areas. The reason for that being the risk factors which caused that specific one to form may cause other vessels to form in the same region or in regions close by. So that is very, very important to understand.